Okay, I'm ready.
Oh, that's good. Here is the question. Right. If you have read and understood, let's begin. Can you identify the structure? What are you looking at?
Okay,
Yes, please.
this is X-ray of the mouth view
Yes.
showing the base of the skull with the first and the second cervical vertebrae.
Okay. Can you identify the structures marked 1 to 7, please? 1,
This
2.
is the arch of the atlas.
Very good. 2,
This is the atlantoaxial joint.
3, please.
This is the bifid spinous process.
Good. 4, please.
This is the body of the dens.
Body of axis. Okay. 5, please.
This is the lateral mass of the lateral mass of the dens.
Atlas. Okay. 6, please. 6.
Okay.
Yeah.
This is the inferior articular process and superior articular process.
Yes, this is the superior and this is
Superior.
inferior. Okay. What do you see in this image other than fracture? Is there anything other? Is there any other abnormality that you can appreciate?
There is prevertebral soft tissue swelling due to fracture and edema.
Yes.
And there's the abnormal alignment between the lateral mass of the and the dens.
Okay, good. All right, let's move on. Here, what do you see? Oh, I'm sorry. What do you see? Image 1, image A and image B. What do you see? Can you tell me?
Yeah, this is the lateral view of the cervical vertebrae.
Yes, yes. In image A, can you identify structures like A1?
Yes, this is the anterior arch of the atlas.
Okay. What is 7?
7, this is the spinal process of C6.
Yes. Okay, 14.
This is the spinal process of C7.
Very good. 3, please.
This is the first strip.
16, please.
This is the trachea.
Very good. 8. 8 is here.
8. Okay. This is the larynx.
Larynx. Okay.
Yes, larynx.
Good. Did I ask you? Have you told me one? Yes. Okay. Moving on to picture B, please. Can you tell me what is 2? Can you identify number 2, please?
This is the body of the dens.
Yes. Right. Number 18, please.
The zygophysial joint.
Very good. Right. 8, please.
This is the larynx.
4, please.
This is the hyoid bone.
Okay. At what level do you find hyoid bone?
C3.
Okay, good. All right. Can you tell me what do you see here in this image?
This is the first cervical vertebrae and the second atlas
From
and the
A
axis.
to F, all of them
From
are cervical
the A,
vertebrae.
this is
Okay.
this is superior view, so C1.
Okay. Can you please
C,
identify? Yes. In this image A, can you identify all the marked structures? What is 2, please?
2, this is the facet of the dens.
Yes, please. And then
5.
3.
This is superior articular.
Okay, 5. Lateral
This is
mass
superior
with superior
articular.
articular facet. Yes.
Yes. 3. This is the groove for the vertebral artery.
Very good. Okay, and
6.
7.
This is the posterior arch. 7. This is the posterior tubercle.
Very good.
8. This
And
is
then
the
8.
transfer process. This is the
Process.
transfer
And
process.
what is transmitted through the foramina?
The foramen transversarium. This transmits the vertebral artery and the vertebral vein.
Okay. Can you tell me the differences between superior articular facets and inferior articular facets? How are they different?
Superior articular facet, this is a kidney shape, while the
And
inferior
concave.
articular,
Concave and kidney shape.
yes,
Okay. And inferior
the
articular facets?
inferior this is it is circular and almost flat.
Almost flat. Okay. Can you tell me what is the difference in anterior arch?
The anterior arch, this is short and thickened,
Posterior arch?
and most likely straighter. Posterior arch is long and thin, I think.
Yes. Okay. And what about the atlas? Is there any peculiarity about the atlas vertebra, which is
The atlas has no body and no spine.
Very good. Okay, which makes it different from the others. What about axis? What is the uniqueness about the axis?
It has body which project upward to form the odontoid beak.
Yes. Okay. Now, moving on to picture B, can you identify number 2?
This is the facet for the articular process.
And 4, please.
This is the inferior articular process.
All right.
Or inferior articular facet.
Okay, moving on to picture C. What is 9?
9. This is the superior articular process.
Superior articular process. Okay. 11.
The vertebral foramen.
What is transmitted through this foramen?
The spinal cord and it is covering meninges.
And
the spinal nerve and the.
You have to tell me everything on the fingertips. You know, time. Okay. All right. Moving on to picture D. Can you tell me what is this 5?
5. This is the impression for the alar ligament.
Okay. What is alar ligament?
Alar ligament.
Yes.
It
connects from where to where, and what is the function of alar ligament?
I can't remember.
Okay, moving on. Here, can you identify 6, please? In picture E.
E6 is superior articular process.
Inferior articular.
Inferior.
Okay. Right. Moving on to picture F. What is this 3, please?
This is the body of the dent.
All right, good. And what is this 1?
This is the anterior arch of the atlas.
Okay. Can you please tell me what are the ligaments which are attached to odontoid process?
The alar ligament and the apical odontoid ligament and the transfer atlantal ligament.
Okay. Can you tell me what type of joint is atlantoaxial joint?
It is synovial joint.
Okay. Can you please tell me what are the ligaments between C1 and C2, please?
The anterior and posterior atlantal ligament and the transfer ligament.
Okay. Anterior and posterior atlantoaxial ligaments. Okay. Can you please tell me where would you feel first spinous process?
At C7.
At C7. Okay. All right. Can you tell me why you cannot feel the upper spinous processes?
because it's short and pivot and attached to the nuchal ligament.
Cervical vertebrae are divided into typical and atypical. Why? What are the features which makes them atypical vertebrae?
Because C1 has nobody and no spine,
Yes.
and C2 has a body which projects upward to form the odontoid beak,
Yes.
and the C7 has long spinous process,
Okay, and smaller foramina transversal.
smaller from transfer.
Yes. All right. How many spinal nerves pass through the cervical vertebrae?
8. There's 8 cervical nerve.
Yes. Very good. Okay. Time has gone, and thank you.
Thank you.
Good. All right. Moving on. What are they saying? Great. Okay, they are happy.
It's really great. And about
Yeah.
the attachment, Dr. Mohammed Alta here, it's from the tip of the odontoid process to the anterior aspect of the jugum, in the inferior surface, right? And the transverse one on both sides of the jugular foramen inferiorly. That's
Yes.
it. And this function is simple. It just stabilizes the atlantoaxial joint.
Yes.
Also, it creates a stabilization between the basiocciput with the dens.
Stabilizes and gives strength. Yes.
Gives the strength. Yes.
Good.
And it's synovial pivot joint
About
actually.
the
Yeah.
structure, yes, it's I know we're called pivot.
Yeah, pivot. Yeah,
Pivot,
right.
yes.
The structure button, the vertebral, the foramen transversarium, vertebral artery and vein, the sympathetic trunk. What about the vertebral foramen?
Yeah.
Tell me. You 4, 5
The
structures
contents.
that you,
Yeah.
yes, all
Yes,
the
for
contents.
fiber structure.
You should
Yeah.
have, like, you should learn them on your fingertip. Everything
Yeah.
that passes through, okay?
First one you
Okay.
have told. The
Yeah,
second
he
one is
told.
anterior posterior internal venous plexus, right?
Hmm?
And the segmental artery from the anterior posterior spinal artery. And there is some loose connective tissue, lymphatics also there. And also the nerve root and dorsal root ganglia. And another one
This is
I
like the
remember the
intervertebral foramen.
No.
Not
It's like
intervertebral foramen.
vertebral foramen, not intervertebral. It's vertebral foramen, like vertebral canal. Yeah,
Okay.
Good.
there's some
So,
little bit
Thank you.
difference in
yeah,
between them. Yeah.
we had recently done a vertebra station, so on 20th November. So I thought, okay, we should have something different. So it won't sound like, yeah, boring. All right.